Hey everyone, welcome back to Beyond the Smile with Dr. Mark. Today we're going to jump into, we haven't done this in a while, so we're going to go and do some internet's most asked dental questions. Always your favorite.
Always my favorite. You never know what you're going to get.
Yeah, so me neither. So I go, actually this morning, I asked ChatGPT. I was like, give me the top asked questions, and I Googled it and I compared, and it was pretty close. It was actually interesting. Yeah. Okay. ChatGPT has that little search function now in it, so it's interesting. So anyways, ready to go on?
I'm ready.
Awesome. So first question is, how often should I visit the dentist?
Oh yeah, well,
every day.
Exactly.
Bring them coffee, bring them
treats are always nice. This is really funny actually. So the actual answer is however often your dentist recommends for you, because there is no real canned response. So there are a couple things that have worked their way into pop culture.
Right.
I believe it's like a 50s or 60s sitcom somewhere that was the one that said you should visit your dentist twice a year. And for whatever reason that stuck. Insurance companies have kind of glommed onto it. And I would say by and large that's the popular conception. Turns out that it works pretty well. I will tell you statistically that after you have your teeth cleaned, that biofilm is building back up within 6 weeks. So if we wanted to treat it as holistically as possible, it'd be every 6 weeks. But, there's practicality there.
Interesting, because I full transparency, Dr. Mark's my dentist. But before I got see Dr. Mark way back when, didn't have a good experience in dentistry, but it was usually once a year. Mm-hmm. And then I didn't go to the dentist for a long time because I hated my dentist. Plain simple. I did. It was like not a good experience, which is not a good thing, but I did. So then obviously things happen, receiving gun lines and stuff. So I have to go more often because of that.
Correct.
Right? Because they're like, well, you should be coming in not once a year. We need that minimum every 6 months, maybe even more. I think at the start it was every 3 months to get things back in order, sort of thing. Right?
Yeah, well, and then it gets, if we really get deep into the weeds, it gets down into what the challenge is. So if one goes after the actual root cause of the problem, then theoretically you can get back to the place where you lengthen the leash back out.
Yeah.
But if we accept that, maybe the biomechanics are not quite right and things are a little bit challenged, then okay, now we're managing and so we will help you out more, and then we recommend a shorter leash.
Interesting. We say every 6 weeks. That's what we decide.
Every 6 weeks.
What causes tooth sensitivity?
A few different things, actually. But at the end of the day, what you have to do is have an insult to the nerve. So you can do that. Typically, if you think about how a tooth is built, you've got nerve in the middle, you've got enamel on top, which is the hardest part of your body, harder than your bones, no nerve endings.
Right.
In theory, that's the only thing that shows up in the mouth. That middle layer is what makes up the root and the underbelly of the tooth. That's all chock full of nerve endings. So if you get gum recession, bone loss, that kind of stuff, any exposure of the root can lead to sensitivity. If you crack or breach that enamel, that can lead to sensitivity. If you stimulate that tooth hard enough, whether it be by force or temperature, and you go through the enamel, that's going to cause it. Yeah.
Interesting. Is there a connection between, like, we were just talking before we went online, we're both getting at the end of our colds or whatever we have, is when you're congested sometimes, like, you feel like your teeth hurt? Like, is that even a connection, or is it
totally. Okay. And oftentimes that's going to be your upper teeth, especially your upper back teeth, because right up in your cheek you have a big gold sinus. And those roots sit basically, if that's the floor of the sinus, those roots are sitting, they don't poke the sinus, but the sinus lining is lying right on top. So
interesting. That was Rob's supposed to ask questions, not you.
Yeah, well, there you go. You don't need to take your teeth out.
There you go. Next question is, what's the best way for me to prevent cavities? No candy.
Yes, well, if you can avoid sugar, for sure. At the end of the day, it's carbohydrate that the specific bacteria breaks down. But then the next best thing to do is just to make sure that you're actually effective with your home care. So, the brush, the floss, the water pick, all the things that the hygienist will have told you.
Yeah.
Including focusing in on the tricky spots, et cetera, but that's basically it. From the standpoint of minimizing the impact of that, of course, then it gets back into regular dental care, because nobody's perfect, and there's a reason why God has created dentists and hygienists. So.
Are you telling me I'm not perfect? That's crushing.
As close as it can be. It's a very nice head shape.
There you go. This leads to the next question, then, because the fourth most asked question is flossing really necessary?
Yeah.
Well, I guess not. If you want cavities and not healthy teeth, don't floss.
I will tell you, there is a genetic. When I was a youngster, first in the profession, I thought, like it's home care, diet. But having been in the profession for 30-ish years, I have patients who sometimes I'm convinced use the wrong end of the toothbrush, if they brush at all, and they have remarkably little to no issues. I have others that are very meticulous with their home care, and yet they still end up with problems. So. Sometimes there's a bit of genetics in there. Yeah.
But you should floss.
100%. Yeah. I mean, it's the only thing that will clean out the bacteria from in between the teeth. I mean, where the teeth touch, there's no toothbrush in the world that's getting in there.
Yeah. Kind of along the same lines, the next question was, do I really need to use mouthwash, or should I be using mouthwash?
My personal thoughts or feelings are not really. Okay. It does depend a little bit on that genetic predisposition. So if you happen to be a person who has a high bacterial load, and there are genetic tests that you can actually do. Like you can sample a person's saliva and send it away and find out what your risk factors are, which is pretty cool.
That's interesting.
And then you can get into a whole host of things, but I mean, I'm assuming when you ask me, should a person use mouthwash, you're thinking like Scope, Listerine, that kind of stuff?
I assume so. That's what I think too.
So no, I don't think that there's a massive benefit to those. Okay. I think if you're really going to get into it, then, talk to your dental professional about things that are a little bit more tailored to specific challenges, problems. Yeah.
Right. Okay. Got it. Why would my gums be bleeding?
Inflammation. It's 100. Well, I guess two things. Number one could be trauma. Yeah. So you could have, been a little bit too excited about the hot pizza, or burned it with soup, that kind of thing. You could have been overzealous with your brushing, etc. But the number one that we get is in and around this topic of flossing. Right. So people say, well, I don't floss because my gums bleed. Well, they bleed because they're inflamed, because there's bacteria in there. So if you get to the point where you can kind of push through that, and let's say you stay consistent for a week, they will stop bleeding because you will have gotten rid of the bacterial load. Right. Okay. So most people freak out, they stop, and then it's just a vicious cycle. Right.
Then by stopping, they're making it worse.
Right. They're allowing for that bacteria just to kind of build up and create that inflammation. So it's just puffy and angry and swollen and just ready to let loose.
Interesting. When and why should I consider dental implants? When you need new teeth.
Yeah,
see?
When you
I could answer these questions.
we should flip the script. Yes. I mean, dental implants are remarkable, and they've been around for, it's got to be like 60 years now. Okay. I mean, the evolution of the technology
has changed for sure.
Has changed, no question. But if you're missing teeth, or you're imminently about to be missing teeth, or you have a situation where your remaining dentition or some of your teeth are hopeless, let's say you're battling infections, etc., they become great options. But a couple things to remember with implants: not everybody's a candidate. So, I mean, you've got to make sure that you have enough bone volume to be able to do that. You've got to have a thorough medical history check. So things that can sometimes complicate that are osteoporosis is one of those things. Not the problem with having osteoporosis, but oftentimes the medications that you're taking for that.
Interesting.
Because that affects the way that bone responds. And then you got to be really meticulous again still with your home care, because you can still get infection around an implant. No cavity, of course. Right. You can get infection. And then you've got to really make sure that the way that they're built into the bite is responsive, because the implant literally becomes part of the bone and it won't move. You can take any natural tooth and wiggle it a little bit, which is why we can take them out. Right. Never going to happen with an implant. So you want to make sure that it doesn't get too much load. Otherwise, you will, of course, cause failure. So.
And then another one of Rob's questions. Yeah. So when do you do a crown and over an implant, or vice? Are those two separate things? Or?
Two totally separate things.
Okay.
So an implant is basically a fake root.
Okay.
So a crown is a new shell, or replacing the enamel that you have somehow allowed to break down.
Got it. Okay.
You had some trauma, that kind of thing, right? So the crown is the working end of the stick. The implant is the supporting end of the stick.
Got it.
Yeah.
Got it. Okay. I think we've talked about this before, but I always find it fascinating because I probably didn't even know until we started doing this, is how does diet affect your oral health? And I know we've had this discussion before, and I think it's interesting how different types of food can affect your teeth.
Yeah, well, I mean, obviously they affect your teeth, but they'll affect your tissues much more. So, when you're looking at the quality of the cheeks, the gum tissue, the tongue, and that sort of thing, because I often, maybe off color, tell people it's your mouth is the start of a tube that runs all the way through your body.
Yeah.
Right? But the section in the middle of that tube is effectively your immune system. About 80% of it is your gut lining. So if we see that the general overall condition of the health of the mouth is not great, one can extrapolate pretty easily that the middle section is not that great either, right? So, another thing that I often say off color is if I had a tumor in my toe, let's say, right, and they're doing blood work on me, they still take it from my elbow.
They
don't take it from
there, right?
So the problem somewhere is a problem everywhere, right?
Interesting.
So yeah, I mean, as a kid, we're told you are what you eat. As a, slightly older adult, you really recognize you are. The 20s and the 30s, you're like, I don't know.
You eat whatever.
True.
That's right.
Yeah,
that's
exactly.
Right. Yeah. That's interesting. I didn't even know what this was, so I can't answer this one.
Okay.
So, what are dental sealants? What are dental sealants, and who should get them? And I'm like, what are dental sealants? I've never heard that term before. Yeah.
Okay. So if you ask Google or anybody what the inside of a tooth looks like, so the groove looks like it sits like so, right? But if you cut it in half, right, and look in there, that groove on the biting surface of your tooth, it's kind of like a poor genetic design, is actually quite deep and quite narrow. So if something gets trapped in up here, right, it burrows down into that groove. And now it's just a time game. Okay, so you can be not so great when you're 12.
Right.
And then, at 16, you discover girls, etc. And now you're brushing and flossing and you just continue on for the rest of your life. That problem that started when you're 12 can show up when you're 20, 25, 30, 35. So the idea behind a sealant is you literally clean out that groove, a little bit mechanically for sure, like polish as much as you can. And then chemically prepared or treated, and then you basically flow in a little bit of a resin, which turns that groove into that groove. Okay. The challenge with them is if they're not meticulously done, you get a little breach or floss. Now you've got like a carport, where stuff can get in underneath, but you can't brush it because you're brushing the sealant, but the bacteria is growing underneath.
Interesting.
So good idea, technique sensitive.
Oh, interesting.
But anyways, to answer your question, poor home care and really groovy teeth, like not lava lamp groovy 70s. But those would be good candidates.
We haven't talked much about like children and oral health but when should children have their first dental visit? But that's a good question.
Yeah, we get this one all the time because we got a family-based practice. Yeah. But we basically encourage mums and parents to bring their kids like really like 1 year old kind of thing, not to necessarily have a visit, but to see the space.
Oh, I see. Just to get comfortable.
So they may come with both parents and then one parent leaves, right? So they just see that the space is, it's safe and it's okay. Most of that early childhood visit situation is more about educating the parent in terms of what they're looking for and how they can be consistent and helpful. From a practical standpoint, it varies based on the children. You see some very mature little kids, and then you see some that are not so much, right? So as soon as they're able to sit and tolerate and have a little bit of autonomy, that could be 2 years, 3 years. We get in there as soon as we can.
Interesting. I never thought about just getting them comfortable in the chair rather, in the space is an important part for a child. Right? Yeah.
Fear in a lot of the things that we experience in life, if we really stop and think about it, they're all learned.
Yeah, for sure.
So what we're
not born fearing a dentist?
No, you're not born hating anything, etc. So a lot of that stuff gets rubbed off. So we try to shape that experience for the individual themselves as early as possible. And part of that's educating the parent.
Right.
Please don't use the dental office as the boogeyman. Brush your teeth or we're going to take you to the dentist. It's like, that's a terrible message. Yeah.
Oh, that's awesome. Hopefully this isn't me, but how can I improve my bad breath? Be like, how can I improve my bad breath?
The number one thing actually is hydration. Right?
So wait, drink some water.
Thanks, I appreciate that. Yeah. No, we get this question a lot, actually. And I think, the not so distant past of COVID really sort of highlighted this because there was a lot more mouth breathing as well. Mouth breathing will definitely dry things out, and you basically get a buildup of stuff. You don't get a cleansing. So that's number one. Number two is, of course, hygiene, right? And I will tell you that flossing is probably super important here.
Oh, interesting.
Right? Because you can brush most of that stuff off, but if you've got lingering bits of stuff
it's just not going to get it.
I forget about it.
Yeah.
And then, of course, checkups, right? Maybe you've got an abscess. Maybe you've got, a cavity, like a bit of rot.
Right.
I mean, if you've ever smelt anything that's dying.
Yeah.
There you go.
Right.
Yeah.
Interesting. You mentioned earlier that some people that came to see you way back when that you thought they brushed with the wrong end of the toothbrush. So what is the proper way to brush with your toothbrush?
You use the bristles.
Turn it the other way around.
Yeah. Well, it's not so much that there's a specific technique, but for sure, if you were to ask dental professionals now, what's the best way to brush? The first answer would be, the brush you use is better than the one you don't.
Yeah.
But assuming that you do brush, I would say electric toothbrush and a good one. So I'm not a big fan of spin brushes and that sort of thing. But if you invest in, either a Sonicare or an Oral-B, I personally like the Sonicare mechanism of action, etc. The toothbrush is basically doing the work for you. So now you want to make sure that you're hearing monotones, just like right. You don't want to be
right.
Scrubbing. It's the scrubbing that can create damage. The electric toothbrushes also have a mechanism wherein that they disengage if you put too much pressure, and they'll give you quite literally feedback. You can brush effectively with a thumb and finger. You don't need a baseball grip.
Interesting.
Right? And then just spend the time, right? I think the average, you should ask ChatGPT or Google or whatever, but I bet you that the average length that a person brushes their teeth is probably somewhere around 30 seconds, which is not enough.
No,
right? So it's about frequency. Okay, so if you're going with your electric toothbrush and you let that thing go at 31,000 brush strokes a minute in the case of Sonicare for 2 minutes, right, you'd have to brush a long time to match
do that
amount of action.
Right.
But if you do that consistently morning and night, the middle of the day is always the challenging one. Very few people are running around with a toothbrush.
No, right.
But making sure for sure at night you give it a real good thorough one. That's where you're flossing, you're water picking, you're doing all of the things.
So is there like during the day? Because I brush in the morning and night during the day. But is that a time where a mouthwash or something would help, like floss and mouth? Like, does it help at all? Like if you did something like that where maybe you're not brushing during the day.
Like even taking water is
right.
As crazy as it sounds, but if you give a little swish and spit in a washroom or something, obviously don't do it at the table.
The office,
Kick it like the
Mark
West.
said.
Yeah, exactly. Just spitting all over the place. That would be helpful. The other thing that would be really helpful is there's a product out there called xylitol, which many people have heard of, but it essentially mimics sugar. So the I mean, it's not the only bacteria that creates a problem, but the one that creates cavities, let's say, for example, feeds on carbohydrate and sugar. So if you take a couple xylitol mints, for example, or a piece of xylitol gum, and you chew those things after you have your meal,
right?
What you're actually doing is you're feeding the bacteria the xylitol instead of the carbohydrate. The bacteria takes it because it thinks it's food,
right?
Doesn't know what to do with it and dies. And so there, you get your benefit.
Interesting.
In terms of battling potential problems.
Interesting. What options are available for replacing missing teeth? I guess we kind of talked a little bit about it.
Yeah, so you have the same options every single time, and it's almost a canned response. So you can go with no teeth.
Yeah.
Right. I make all kinds of jokes that there are people on the planet that prove that you don't need teeth to live. Processed food and such.
Yeah.
Second one becomes some sort of removable device. So you're talking about either a complete denture or a partial denture that has teeth for the actual missing spaces. It somehow.
Right.
There are a lot of different ways that it can sort of attach or grab onto the remaining teeth if they're stable enough. That's option number 2. Then you get into your fixed options. If there's a tooth on either side, you can bridge it, just like the bridge going across the lake. You need 2 shores, right? So you need 2 teeth. Or you go with dental implants, right? And those basically become your options, right? You got a removable option, 2 fixed options, and also nothing.
Nothing.
Yeah.
Which we don't recommend. Last question is, how can dental health affect overall health? Sorry. How can dental health affect overall health?
Yeah. Well, I mean, health in general is an interesting topic. So in my experience, generally people that I see that are healthy in one arena are healthy in almost all arenas, right? So, but from a dental health perspective, person's free of infection, free of pain, has teeth, and is able to chew. If you sadly go to, let's say, retirement homes, and you just sample the population, those with natural teeth fare much better than those with fewer teeth, etc. Just your ability to actually break up food, and nourish yourself, I think is critically important. Second part goes back to that whole immune system. If you've got infection and a situation that's out of control in your mouth, and you're literally swallowing that thousands of times a day, I mean, that's a horrific strain on the body. And remember, your immune system's an army.
Right.
It's X size.
Yeah.
You don't get to supersize it on Tuesdays, etc. Which means if you've got infection somewhere, it means part of your army's permanently deployed fighting that. Which means you're that much more susceptible to everything else. Which can be a significant challenge, particularly if you chuck in things like autoimmune.
Yeah, everything else, right. Yeah. Interesting. Well, that was fun.
That was fast.
Was it?
Yeah. How many questions was that?
That was 14 questions.
14 questions.
Yeah, you're quick. You know what you're talking about. Well, thanks everyone for listening. We went through internet's most asked questions. There were 14 of them anyways. Yeah. I always say be sure to check out Kelowna Dental Solutions if you need dental care. You can stop by and just ask Dr. Mark some random internet questions too. He loves answering questions.
Absolutely.
Make sure you bring a coffee though.
Yeah, double latte.
Double latte, there you go.
Oat milk, please.
Thank you for tuning in, and we'll talk to you next time.
Take care.
Thanks.